the health and wellbeing podcast from Kingsbridge Healthcare Group, which comprises Kingsbridge private hospitals in Belfast and Sligo, Kingsbridge Eye and Hearing Care and the Kingsbridge Training Academy. My name is Avril Keys and I'll be hosting this series of podcasts putting real patient questions to the medical team at the hospital. From diagnosis through to treatment, we'll give you the lowdown on what to watch out for and when you should make an appointment. And if you have a question you would like answered in a future podcast, you'll find our email address in the description below. The next guest on the Kingsbridge podcast is Shea McAleer, who is the sports physiotherapist in Kingsbridge Physiotherapy and Sports Injury Clinic, which is based at the PEC in Stranmillis here in Belfast. Shea has many years of physio experience in elite sport and in the community, and his clinical interests include lower limb biomechanics and chronic lumbar spine dysfunction, which is music to my own ears. Welcome, Shea.
Thank you.
I had Mr. Pev in on an earlier podcast talking about medical interventions available for back pain, and we talked a lot about the positive impact that physio can have. So it's great to be able to have this chat with you about the kind of hands-on treatments that are available, and also to address some of the questions that came in to me about managing chronic pain in an active way and hopefully avoiding going down the surgical route. Can you tell me a little bit, I suppose, because back pain is the primary subject in a lot of the questions I've got in, why is back pain so prevalent and what lifestyle factors can be attributed to it in your experience?
With low back pain, and especially it's quite topical at the minute in the current climate with a lot of people at home and homeschooling. People who are quite sedentary and people who don't exercise a lot can tend to suffer from low back pain. And especially at the minute where people aren't exercising as much as they used to. Their kind of homework setups aren't the greatest, and that can all affect it as well. So, low back pain is one of the most prevalent issues within the musculoskeletal sphere. It costs the NHS many thousands and millions of pounds per year to manage. So it's especially chronic low back pain is an incredibly challenging issue to manage. There's a huge multitude of factors that we need to think about, and as physios, we should never just look at the injury site or the actual the pathology. We need to have a very holistic approach to someone with chronic low back pain because those other factors could be the key drivers of pain, and there's a lot of scientific data out there at the minute over the last number of years around the impact of psychological factors such as anxiety and depression on low back pain.
Yes, and that is a question that did come into me. Right. So is that really a thing?
Oh, absolutely. Yeah. Absolutely, yes. And how that manifests is the anxiety and depression will drive what's called the sympathetic nervous system, okay. And that's essentially your fight or flight response mechanism. So and when people are anxious or they're under a lot of psychological or emotional stress, that they're in this fight or flight status for excessive periods of time, and how that manifests is when you're in that status, people don't breathe normally. They kind of take short, shallow breaths, and their heart rate goes up. And you sometimes see people when they come into the clinic who have really acute, severe pain, and their shoulders are elevated, they're hunched up, they're a ball of anxiety, and they're talking really fast, and you can almost judge by the speed of their speech that they're hugely anxious about this. So, and that when people are like that, they don't breathe deeply enough, and there's a lot of evidence that your breathing can have a huge impact on how well you can activate your tummy muscles or core muscles. So when you breathe deeply, you take a big deep breath in, your diaphragm will lengthen, and when the diaphragm lengthens, your pelvic floor or your tummy muscles will contract. So if you're not able to take a big deep breath in, or you're never doing that during the day or even at nighttime, you will struggle to fully activate your pelvic floor, and when we talk about lower back issues, as you well know, your pelvic floor and your trunk control is crucial to fixing that problem. So
it's fascinating, and I find myself both sitting up straight and
Yeah.
breathing deeper as they talk to you. So
Yeah.
that's amazing.
Yeah, and it's a technique. It's a technique that we use in the clinic, and the term is diaphragmatic breathing or deep breathing exercises,
Mm-hmm.
and we sometimes would use this with clients without doing any hands-on treatment on them,
Okay.
because people who come in who are in that real hugely agitated state, if you put your hands on them and do something incorrectly, you can just really flare them up. So,
Yeah.
and sometimes by teaching these people how to breathe correctly, using this as part of an exercise program, that then allows them to relax, get out of that real highly agitated. They go into this other, what's called the parasympathetic nervous system, which is your rest and digest, and then that allows things to relax. And we've, it doesn't work for everyone, but I've, in my experience, if your assessment is correct and you feel this is indicated, you could use this technique and retest someone, and if they start to improve at a clinically relevant level, and then that can be your treatment. So
that's amazing, and I suppose it leads me on to, I guess, the treatment goes beyond hands-on, and I think a lot of people just see the physio somewhere they go when they're in pain and they get a hands-on treatment and it hopefully helps. But there's more to it than that. You have lots more treatments that you offer beyond that. So anything else other than that? The breathing techniques.
Absolutely, yeah. We would the first protocol is your full holistic assessment, and that really is the cornerstone of the whole process. And you need to, and we would spend a lot of the first session with clients and assessing them and really getting their story from them. And it may be that this isn't a musculoskeletal or mechanical problem. This is more of a psychological or a stress issue or a cognitive issue, and sometimes we would then refer on back to the GP or refer to other specialists in that area, because this may not be something that's going to respond to intervention for physio. So, but other things we'd look at, we would look at it may be a biomechanical issue, so we would look at some trying to correct their biomechanics. It could be neuromuscular. The muscles just aren't firing correctly around the hip or the trunk. So we would give the client exercises to try to recruit their lower abdominals, try to correct some of the kind of movement patterns which are causing their issues, and it could also be an area of the body away from the spine. Some people can have a foot problem or an ankle problem, or it could be the way they walk. It could be a gait problem. It could be the way they lift or the way they move. It could be anything. So, and if you don't look at the whole picture and correct that, and if you just look at the lower back and you just work at that, you're just not gonna fix that problem. So it has to be, you have to work at that area, but also look at the bigger picture.
That's really great to hear, because I think you do focus on the bit of you that hurts when you're in pain, and I'm a great believer that there's often lots of other factors that are playing into it. If we just circle back to the lockdown talk, and very interesting about the anxiety connection with pain. And obviously lots of us were quite anxious at the beginning of lockdown when we didn't know what was going to happen. But in terms of now all the people working from home, and I'm guessing that you're seeing lots of people with back issues present, because, like you say, we're more sedentary when we're at home. What are the right and wrong ways to work from home? What should people be thinking about when they're setting up a home office?
Yeah, traditionally, a lot of the literature would have focused on a very specific position to sit in, whereby people talk about sitting upright or get your shoulders back, and there was you see some things where there was very specific around angles and different things. But some of the research that's come out recently, I know Kieran O'Sullivan's group in Aspetar looked at this, and what they found was that there's no really correct sitting posture which is effective at managing lower back pain. Okay. And there's no specific setup of your desk which is effective at managing that. There are some suggestions that would make, but the data doesn't stack up when we talk about the old traditional advice as to sit up upright. And the theory behind that is that some people, you have to respect the normal curvature of the spine. So the lumbar spine is supposed to curve inwards and concave, and sometimes people, if they sit up too upright and they come forward too much, you're actually pushing way beyond the amount of curvature you need to have. And the same with trying to pull your shoulders back excessively. The upper part of the back is supposed to curve in a convex way. So if you extend back, you're almost pushing against the way the spine should work.
Okay.
And also, if people tend to sit up too tall, your neck is supposed to come forward slightly and have a normal curvature. So, so the crux of it is, I think there is no right or wrong way of sitting. The problem is the duration people sit in the one position. So if people don't get too hung up on what position they're in, try to move and the suggestion is every 30 minutes to 45 minutes you stand up, you walk up and down the stairs, walk around the room, do some simple movements, simple exercises, and then pop back down and away you go. So it's more about breaking up the posture regularly, changing the posture in regularly, but also respecting the normal curvature of the spine. So as long as you're in a position that you can comfortably be in for a long period of time, then that's what they look for. So
okay, that's really interesting because I've been really conscious of how I sit.
Yeah.
But probably more than I have been conscious about getting up and moving.
Yeah, that's the key.
So.
And some people, when they do try to sit in that upright position, over time it also starts to fatigue the muscles because it's quite challenging to stay in that position. And occasionally that can lead to other problems because you're now starting to fatigue your mid-back muscles or your neck muscles because you're trying to sit so upright. So now you have a lower back problem. You've also given yourself a mid-back problem as well. So
maybe set a phone alarm for every 45 minutes or so, just 45 minutes encourage you.
And it's something simple as stand up and just move around. There is some evidence around standing desks and sitting desk, but again the evidence isn't it doesn't back up one or the other.
That's interesting. What about sitting on the sofa when you're working from home?
Yeah, again, you have to. It goes back to respecting the curvature of the spine. So there should be a slight inward curvature or concave. So if you're
at the base of the spine,
at the base, yes. So in the lower part of the back, yes, just a small curvature inwards. So if you're on a sofa and you're kind of hunched over for more than 30 minutes to 45 minutes. You may, there's no definite yes or no, but you may start to get a problem. So, I mean, you could sit in that position for 30 minutes, but then after that, move around, change position, sit somewhere else or stand up.
Yeah.
So,
okay.
Yes, and that really has, that message or that research has changed over the last number of years compared to what it was before all that.
Yes. So. And I'll come back to COVID specific issues because I know you're dealing with some patients who've been through COVID, but just to kind of cover off some of the other back questions. So say someone they're actively in pain at the moment, they bent down to pick something up and they've felt something go in their back, they're in a real spasm. I mean, what is the best thing to do? Should you go straight to a physio at that point? Or should you manage the pain at home for a little while beforehand? Yeah,
a lot of that depends on the symptoms that they have, and there's certain red flags or certain really signs of potential serious injury or serious pathology there. So if somebody has bilateral leg nerve pain,
so that's going down both legs.
Going down both legs. If they have low back pain, which then they also have kind of bladder or bowel deficiencies, was not working correctly. If they have night pain or unrelenting pain, which is severe, then if someone has those issues, they need to go to their emergency department. They need to go straight or contact the GP straight away. Okay. So that was definitely not a physiotherapy issue, but everything else outside of that, we can see clients fairly early on after they have an acute injury, and if someone comes in and they're really acute, as we said earlier on, potentially some of the breathing control exercises, trying to reduce their anxiety, trying to get them to actually inspire deeply. That allows them to recruit their pelvic floor, teaching them just some simple pelvic movement exercises, and giving them some advice and reassurance and exercises to then carry on with straight away. There's lots and lots of things they can do day one with an acute problem. So, possibly the hands-on work may not be indicated that early on. It's just people are just too sore and too acute. But I think definitely get in early. And plus, physios who have a lot of experience in this area can then assess the client and determine whether or not they need to see a spinal consultant straight away or a GP for pain medication. So
Yes.
so we can then almost be the signpost then as to where they go from that point, because some clients may not require to see a spinal consultant straight away. That may be a thing that will resolve with physio initially. So
yeah, and Mr. Pev mentioned that about that the pathway, that you would typically have painkillers, look at physio, and then moving on to maybe looking at injections or surgery beyond that. So and I suppose I had questions from people who asked about exercising when in pain. Are there any guidelines? Should you push through? Are there certain conditions like sciatica that you should maybe be careful about exercising when you're in active pain?
Yeah, I think if in the realm of sciatica or nerve pain, we would advise that you don't push through nerve pain that's at a significant level. So on a scale of 0 to 10, if someone is having nerve pain at a 1 or 2 out of 10 during the exercise, but say 60 minutes after the exercise the pain is gone, then that would be acceptable to continue on. Or the next day, for example, there's no increase in their pain. Whereas if they're doing exercises and during the exercise their pain is 3 or 4 out of 10 or higher than that, and the next day they've had a significant jump in their pain, then you would say that what they did was too much. I think in the realm of someone who has chronic low back pain, the back pain has been there for quite a long time, or diagnosed with mechanical back pain, again, the threshold for working into discomfort is slightly higher, so you would allow, say, a 3 out of 10 or less for that, both during the exercise session, but it should be gone within 24 to 48 hours after that event. So, so definitely we would, and that's a fairly, from a physio perspective, it's important that clients are educated fully on that, because that's an extremely important skill for the client to know, and they have to really know their own bodies as to, well, what is a 3 or 4 to 10, and sometimes the 3 or 4 to 10 can be quite confusing. And what we also say is, if this pain is manageable, or you think it's something, at a low level, it's not beyond what you can exercise through, then that's acceptable. But patients who have had chronic low back pain, they will know what is pain that's not good and what pain is okay, it's stiff. So that's crucially important. And the ability to exercise within a low threshold of pain is crucial to patients getting a good outcome, because you can work into this to a small degree, and people can walk and they can exercise and cycle with a small bit of pain, and those patients actually get better quicker than the other cohort of patients who are really apprehensive about doing anything, and they don't really push.
And with cycling, in some cases, maybe something like cycling or swimming, which is non-load bearing, be a better approach to explore over walking, for instance. Yeah,
in the initial phase of acute back injury, definitely cycling, walking would be fine. And then you would move into more load based stuff like walking, or stuff like that later on.
And in terms of I guess ongoing exercise beyond a point. So I'm at a stage where I don't have any pain now, and it's trying to understand what is best to do. And I've asked the other kind of doctors in that specialty around running, particularly. So what's your stance on running post back injury?
Back injury, yeah. It like a lot of that will come down to the nature of the injury, and if someone is post-operative, or if they've had spinal surgery, that really is a conversation between the operating consultant and the client, and as physiotherapists we would take guidance from the consultant on that. I have had clients who've had certain types of spinal surgery and have returned to run and returned to sport and returned to play rugby, and have no problems whatsoever. But it's all about structuring. When a client comes to see us, they have to have clear goals, and they have to hit clear targets before we would determine they're ready to go back to run.
They wouldn't be running a marathon straight off. It would be
definitely
building
not,
up.
No, building up really slowly. But definitely we've had people who've come in with fairly significant low back pain and neck pain, and who have made full recoveries and go back to run marathons after
that's
that.
Good. Good to hear. And I suppose specifically, and I would have a lot of followers who are older late 40s into 50s, where muscle tones may be reducing, and have asked me what kind of activity should they be really actively doing at the moment to help prevent, say, injury and things like osteoporosis when they're older.
Yeah, and for that cohort of people, definitely strengthening exercises are quite important, because muscle tone will diminish. So doing things like weight so even light resistance training, either with dumbbells or hopefully when the gyms reopen, into a gym scenario using some of the machines. Definitely some of the more impact type activities are good to help to alleviate or mitigate the effects of osteoporosis. So walking, some kind of a cross trainer type exercise as well will help with that also. So again, that cohort still, a lot of clients do still run in that sphere, and they also walk quite a lot as well. So a combination of the aerobic exercise, some of the impact type exercise, and the resistance training exercise would be advisable for that.
So don't slow down, basically.
Definitely keep going, push up. No, definitely. No, we've lots of clients in that age group who are really, really fully active and still really.
And in terms of your, just thought it was interesting, your day to day. I mean, you have a mix of obviously patients, general public coming in for lots of different issues, but you also work in elite sport, and I just wondered how that mix works for you, and are there aspects from each that you bring across?
So obviously in our clinic we have a general musculoskeletal service, and we also have live experience in professional sport, and our other physiotherapist worked in professional sport as well. So we do have both aspects to our treatment. I really thoroughly enjoy the non-sporting population coming in, and because some people from that cohort have got some of the most challenging presentations you're going to see. So some of the real chronic pain, chronic low back pain. Some of those clients are ones you get the most reward from helping, and from getting those people back to achieving their goals. But we also enjoy the working with elite athletes. It's a nice mix, and we can bring learnings from both categories to each other. So, but we do get a lot of satisfaction from helping the general population. Sometimes trying to get someone back to playing football or back in the field, when you compare that to trying to get someone back to actually doing a job who's remortgaged and relies on it, that's a completely different different sphere of pressure, and we thoroughly kind of are passionate about that for our clients.
I think as a patient, it's nice to know that mix of skill is there, because I think it gives you great confidence then in coming to see somebody.
Yeah, and it also helps when a lot of our clients they may not be professional athletes, but they are runners, and they are amateur runners, and they are going back to sport. And when we have that training within the elite sport realm, we can then apply our skills to that, and we like to think, and we have an ethos that we want to bring the same level of care to our non-sporting population that we do to our athletes. So the general population who come into the clinic are getting the same level of care and the same detail of programming and exercise programs, and the same quality of treatment that we would give to some of our pro athletes.
And in terms of other things, we've talked a lot about backs. I know that I had questions in about foot issues in particular. I can't say the name of the, but is it plantar fasciitis?
Yeah. Plantar fasciitis. Yes, it's an irritation or an injury to a structure or connective tissue that's on the bottom of the foot that attaches on to the heel bone on the right and the bottom, and it's really quite a debilitating and quite a.
So is that heel pain then you get from
it?
Yes,
heel pain on the bottom. So as opposed to the back of the heel, it's more on the sole of the foot, right at the very bottom, and it's quite a debilitating injury. It is common within runners, but non-runners can also get this problem. Generally comes on as a slow onset, but really can stop people in their tracks. And there's a lot of good evidence out there as to treatment methods for this, and the key treatment is exercise therapy and giving people enough exercise and strength and loading through that tissue to repair. But we can also use other things like shockwave therapy, which is a service we do provide through our clinic.
It sounds a bit alarming.
Yes,
so tell me
shockwave.
what
It is.
that is.
It's worse than it sounds, and it's no, sorry, it isn't as bad as it sounds. Sorry, got that wrong. It's not as bad as that. It is quite painful, but it's not that bad. But it's really, really effective adjunct to use as part of treatment, whereby we'd use the device to create a kind of a micro trauma and some cavitation bubbles within the tissue that helps to speed up repair and helps to stimulate the repair process.
So you're shocking the foot, basically.
Exactly. Yes. Yeah. We find that when we use that with the with loading strategies, that can really help to speed up the process.
Yeah, that's great, because I think a lot of people think of physio as being very much just hands-on, so it's great to know that there are other treatments. I know you've worked a lot with people who've had COVID, and I guess it was just to bring that point up, because there may be people listening who did unfortunately go through the virus and have been compromised potentially from it in terms of getting back to full strength and full fitness. Can you tell me about some of the work you've done in that space?
Yeah, we it's all about first of all, whenever clients come to us who've had COVID, we first of all, they need to be cleared by their GP. If they've had moderate or severe illness, they have to be medically cleared to go back to exercise. But those who've had COVID and had mild symptoms, the first thing is to advise people is to kind of plan what they're going to do and really work within their limitations of what they can do. So
what are you seeing with these people? Is it breathing issues primarily?
Mm-hmm. A lot of people suffer from breathlessness, so we teach some people positions that they can get into that helps to reduce their breathlessness. So we may get people to lie on their side on a high pillow, or they can sit kind of forward with their elbows resting on their knees, and that can help just to slow down their breathing and allow their breath to come back. And these are positions that they may, or techniques that they may use when they're exercising. So if they do get quite breathless, they would get into these positions that helps to kind of calm that would slow that breathing rate down.
And have you had good success with it in terms of people?
We really have, we really have. And we also teach them kind of deep breathing techniques, which also comes back to the first earlier on talked about the diaphragmatic breathing and how to actually control that breathing to do that. And we do see people who that breathlessness tends to improve. They're then able to get back into exercise, and then we like to from our experience of working within exercise therapy, we like to prescribe exercise programs or return to walk programs for people and how to guide them through that, and build
them back up slowly again.
Yes, exactly, back into what they want to do, rather than go too quickly and jump in and maybe become ill again.
No, it's amazing. I suppose you wouldn't think of that potentially as a if you've been through COVID, how much a physio can help you. So that's really good to know. And I suppose just the patient pathway, I guess, to come and see you. So if I wanted to attend, what would I need to do? Would I need to speak to my GP first, or can I just make an appointment?
No, we can just, if you're self-funding, patients can just make an appointment, and they can just ask to come directly and see one of the physios. Occasionally people will see a consultant first of all, and they will be referred to us by the consultant. We tend to work quite closely with a lot of the orthopaedic consultants within Kingsbridge, yes. And we have a very good relation with a lot of guys, and we tend to work quite closely with clients to try to get the best outcome. So yeah, and with some clients who may have medical insurance, will have to get a referral through their GP or by one of the consultants before they come and see us. So
okay. And then one final question is, is there merit in attending a physio on a regular basis, even if you're not in pain?
I really think there is. I think physios, people may not have symptoms, may not have pain, but there may be certain areas that they need to work on to ensure that they don't become painful. So the people need to be proactive about that. And what we tend to do is when we assess a client, on the very first session, we assess them. We have clear outcome measure criteria that we measure, and we would give the client scores in certain areas, and that would be something that when they come back for their 1 month or 2 month or 3 month review, we would recheck those outcome measures, and if they're significantly down, we would then, that would be almost like a warning to the patient that they need to work on X, Y, and Z to try to get back up to the level they were when we discharged them, to ensure this doesn't come back. Or also we would advance their exercises, make their exercises more, kind of more challenging, build them back up again. And sometimes clients kind of picked up other issues that they may not feel are related to their lumbar spine, but down the line possibly could contribute to it. So we would then
it's a good investment in your health, I suppose.
Absolutely.
Worth considering. If I suppose, like myself, where I have recurring episodes, it's something I've certainly considered. So that's good to know. Shea, thank you so much for your time today.
Thank you, Avril. Thank you.
And thank you for listening. You can listen to all of our podcasts across all of the podcast channels. We're also all over social media, and we have an email address. All of the links are below, and look forward to joining you at our next podcast.